on the 21st of December. If the government, in a move which they made without any consultation, without any facility to debate, they announced unilaterally the cut and ultimate elimination of pay for pre-registration nursing students and midwives who are on a 36-week mandatory clinical placement. And let's get rid of a few myths to begin with. Number one, the government, in its pathetic protestations to defend this, suggested that somehow or other they were dealing with a situation where nurses and midwives on the undergraduate programme were treated more favourably in this country than anywhere else. Myth number one. Student nurses and midwives in this country are not treated any more favourably than nurses and midwives in other countries. We're not seeking payment for when nurses and midwives on the programme work in a supernumerary capacity. Throughout the 4 years they do that. But for specific mandatory 36 weeks, they must work as employees. They replace qualified staff. They provide direct patient care. They're an integral part of the ward workforce. They work the full roster, earlies, lates, night duty, weekends, the lot. They have employee obligations and so on. And the government, as I've said, sought to unilaterally eliminate and ultimately remove this payment so that they work for nothing, slave labour. So today, in collaboration with SIPTU Nursing and the P&A, and in fairness I have to say the 100% support of the Union of Students of Ireland as well, we're announcing the launch of a campaign aimed at bringing a reversal of this pay cut about. And that campaign has a number of stages already. One, on Wednesday week, the 9th of February, we will have a lunchtime protest in 13 hospitals across the country, north, south, east and west, between 12:30 and 1:30. And on that day, upwards of 6,000 nurses and midwives in training will participate, and they'll also be supported by their qualified staff in those hospitals. The following Wednesday, on the 16th of February, we are having a protest march and rally from Parnell Square to the Department of Health and Children, where we will hand in a letter to the Minister. And then after that, on that afternoon, a student delegation will be meeting the 5 political parties going forward in this general election, and we'll be asking them a straight question. If they're in government, will they reverse this pathetic, sad, cruel and unnecessary decision and restore to students the agreed pay rate of 80% of the staff nurse scale? Whatever response we get from those 5 political parties will be given out immediately thereafter to the 6,000 strong body of nurses and midwives, of students, and also obviously to their extended family. And we'll be certainly, I don't think we'll need, I would imagine without any moment's hesitation, the response from the political parties will greatly influence how these people will vote and how their extended families will vote in the forthcoming general election. And any political party that says it will not reverse this pay cut, I think I can safely predict will not get one vote from nurses and midwives in this country, because nursing and midwifery as a whole will not put up with slave labour being put forward by any government, outgoing or ingoing or whatever. So once that is done, the next phase, should it be necessary, will be that through that process, during those same few weeks, we will be balloting the 4th years that are currently on their rostered placement, and we will commence industrial action at ward level, if we have to, in early March, which again will be supported by students in the 3rd, 2nd and 1st years. And that industrial action will continue and will be escalated as required until we get common sense prevail and a reversal of this very, very flawed and unfair decision. So that's the campaign that is being mapped out.
Just from my own meeting students around the country, I've been at Our Lady of Lourdes in Drogheda, and I was in Letterkenny last week, and I suppose it hit home to me exactly what sacrifices our students go through to actually even start their training as nurses and midwives for the future. I said I met a lovely second-year student midwife who actually is from Dublin and going to Dundalk IT, and she was doing her placement in Letterkenny. So she her parents had to fund her renting accommodation in Dundalk. She was renting in Letterkenny for her placement, and this week she started in Cavan. So she had to rent another place in Cavan. This is the reality that our students are putting themselves through. Right? It's not just solely about money, it's about recognition for the profession that we are and respect for that profession. And I think that this government has shown a lack of respect for nurses and midwives in the future, and for that it's unacceptable as far as I'm concerned.
The final leg of the stool is just again to inform, I suppose, the media and the public that in addition to the campaigning side of this, the unions have already initiated a referral to the Labour Relations Commission and, if necessary, the Labour Court, on the basis that this is clearly a breach of contract. Everyone who started the programme knew that there was an 80% arrangement in fourth year. That's been reneged upon. And, you know, contrary to what the government might think, it can't just rip up contracts with people while it acknowledges contracts for its retiring ministers who will be living on $125,000 a year, but these students are not entitled to have a few thousand to pay their digs and so on and so forth. So we're not having it, and we won't have it. And then finally we'll be taking equality claims as well. This campaign will have many facets. This campaign will continue for as long as it takes, because, as everyone has said, we are not going to have slave labour. We are not going to have nursing and midwifery demeaned and devalued by this outgoing government, and they're not going to get away with it.